Will you send your kids back to school in the fall? It's a decision many parents are grappling with. To help you decide, I'm joined by Dr. Thomas Murray. He is the Associate Medical Director of Infection Prevention at Yale New Haven Children's Hospital. Thank you for being with us, Doctor.
Nice to be here. Thank you.
How do you know if going back to school is the right choice for you and your child?
Yeah, it's a great question, and it's an individual question that each family really needs to make on their own. And some things to think about. The first thing is the health of your own child and whether there are any underlying risk conditions that would put them at risk for more disease. The second thing you want to think about are kind of what the school has put in place to make it safe for your child to return.
Right, and I know they're sending out response plans, and we'll talk about what you want to have people look at that. And let me ask you that right now. What do you think we should be looking for in those plans to make us feel good about going back to school?
Sure. So more generally, the first thing we need to keep an eye on are the community transmission rates. And right now in Connecticut, we are doing a spectacular job of keeping our rates at right around 1% plus or minus compared to some other places. So that puts us in a really strong position as of today. So that's positive. With respect to the schools, things that you need to look at include plans for social distancing, how they're going to manage mask wearing, and what are plans for hand washing and sanitation of the environment.
And what about peer pressure? What if perhaps you're living with an elderly person or your child does have an underlying condition, but they're saying, but mom, all of my friends are going back?
Yeah, so that's when it's time to talk to your pediatrician and your doctor to really understand what that risk is and to truly understand the benefits of being in person. Because I also agree there are tremendous benefits to being in school together with your friends, but you got to mitigate that with the risks of contracting the virus.
Yeah, and there is a great risk to leaving them home too, because there's a mental health risk and they're not having the opportunity to socialize at a really important time in development.
Yeah, absolutely. And the other piece of that I think is important to realize is that it seems like even with the possibility of a vaccine on the horizon, that this virus is going to be with us for the foreseeable future. So it's not a situation where, in the spring or next fall, there's going to be zero COVID around. So we all need to really think about how we can begin to do things that are important to us, like bring our children back to school with this background of COVID transmission.
Dr. Murray, thank you so much. Thank you for being with us and sharing this great information. And we'll have you back to ask some more questions in a little bit.